A simple and reasonable approach to treat hypertension, and it won't cost more than $20 a month. I'm Dr. Evan Levine, board certified cardiologist. If you appreciate my videos, like, share, and follow. Now remember, this is not perfect for everyone, so always talk to your doctor, but this is a simple idea. Now the plan is to get you as close to 120/80 as possible. 130 is not controlled, and you want to do this with the least amount of pills and always once a day. Now, I'll start usually with an angiotensin receptor blocker. I always pick generic medications, and there's actually a new ARB out there that appeared on the scene years later, and it's enormously expensive. But my top two are generally valsartan and olmesartan, and the other ones are perfectly fine: telmisartan, candesartan, and losartan. Now, I use these because if you need an additional medication to get you to goal, as the majority will, most people need over 2 medicines, I'll choose a calcium blocker, amlodipine, find the right dose, and then add it into the angiotensin blocker, still on 1 pill, and they're all generic, and again, they all cost less than $20 a month. And if you need further blood pressure medication, I'll choose hydrochlorothiazide. That's a great mix, because if you have some mild edema, swelling from the amlodipine, it will help that, and it also boosts the power of the angiotensin receptor blocker, and they balance each other out real nicely, as the angiotensin receptor blocker increases potassium and the thiazide reduces it. Now, there are 2 generics out there with all 3: amlodipine, valsartan, hydrochlorothiazide, and amlodipine, olmesartan, hydrochlorothiazide. The problem is there are not a lot of generics for one, and it may be too prohibitive in price. So the generic called of Tribenzer, olmesartan, amlodipine, hydrochlorothiazide, probably the best for many, because you can have that for $58 for a 90-day supply. But the generic Exforge, that's a problem. That can cost as much as $700 a month. So here's the winner: olmesartan or valsartan, then amlodipine valsartan or olmesartan amlodipine for $62 or $45 a month without insurance. And then if you don't have insurance, olmesartan, amlodipine, hydrochlorothiazide. I hope that helps.